Good morning or afternoon, everybody. Thank you so much for joining us. We are going to get started, but first I just want to introduce myself. My name is Rachel Wade. I'm the VP of Marketing here at May. And for those of you who are not as familiar with May, we are a digital health platform specifically designed to address Black pregnancy. We are an engagement platform where we provide weekly pregnancy tracking, risk assessment, resources, and education specifically designed with us and our pregnancy, postpartum, and motherhood journey in mind. And we are partnering with insurance companies to provide support for their populations birthing under Medicaid. And we are equally focused on supporting Black birth workers. For us, that is a huge piece of this solution. So we are working with Black birth workers to support as well. So if you are pregnant or know someone who is, or thinking about it, please visit us at meetmay.com to learn more. If you're a birth worker looking to understand more about how we provide support, you can visit us also at meetmay.com under providers or meetmay.com/doula. And if you are interested in learning more about these kind of conversations, please follow us at May Health Inc. on Instagram, where we share a lot of education, information, and conversations like this. This is a part of our webinar series that we created designed to provide space for conversations about a variety of topics related to our pregnancy, motherhood, and postpartum journey. And this is one we're really, really excited about. Our team spends a lot of time thinking about things that we would want to have discussed when we were pregnant and what we wanted support around. And hair is something that always comes up on our conversations. And also self-care. As mamas, many of us are wearing many crowns, and we have to find balance for ourselves, and all of that ties into our mental and our physical health. So this panel is an incredible group of women that can speak to all of those things. And I'm going to stop talking and let Rachel Nix, our host, introduce herself and everyone else. We're next to each other, so I apologize. We're going to work on the logistics. I'm going to hide myself and mute, and I will let her speak.
Okay. Yes, we have a new crown, a duo, Rachel and Rachel, RN squared DJ dynamic duo. Okay. Anyways, hi everyone. I'm Rachel Nix, born and raised Oakland, California. I'm a halfie. I've been in New York half of my life. I have two boys, 5 and 2. They are full of life and energy and keep me going. Let's see, my crowns. I am a Juilliard trained actor. I am a trainer with a specialization in pre and postnatal fitness. My favorite muscle group is the pelvic floor. I am also a doula, a lactation counselor, and the founder of Birth Queen, which is a nonprofit that I founded 2 years ago to combat the Black maternal health crisis. And I'm all about staying in our power and our beauty and our joy. And I'm so honored to be here. So thank you for having me. And I'm gonna toss it back to my queen, Rachel, to introduce the rest of y'all.
Let me come in your thing so I don't have to try and navigate this on my own. Okay, so I'm super excited about this panel. With us today, I'm just gonna very quickly introduce Miss Ashlee J. Johnson, founder, also a doula, founder of Birth Class in a Box, Dr. Afiya, who is a doctor, hairstylist, and founder and CEO of Psychohairapy, Dr. Michelle Owens, who is May's incredible clinical director, and Octavia Smith, who is an incredible May doula in the DMV area, and she also is a hairstylist. So super excited to talk to everyone. I don't know if we want to very quickly go around. Ashlee, maybe start with you, say a couple quick words about something about the business, and then also just relevant to this conversation, and then we'll let Rachel kick it off.
Sure. Yeah. So like she said, Ashlee Johnson, founder of Birth Class in a Box, and I create space and resources like the Birth Class in a Box for Black birth workers to get started and to thrive. And so self-care is embedded in the work that I do, and encouraging folks to do self-care, and not necessarily from or always from get your hair done, take a bath, but also setting up systems and putting folks around you that can help you really take care of yourself, and more on a deeper, psychological and like logistical standpoint to care for yourself in that way.
I'll toss it to Octavia.
Hi, everybody. I'm Octavia. I am a doula here in Southern Maryland and DC. I've been a hairstylist licensed since 2014. I am also an energy body worker. We didn't put that on there, but that's a big thing, especially with how I cater to my clients during the birthing process. So I figured I'd throw that out there. My main goal is to just make sure that anybody that encounters me, they feel safe, they can be themselves, they can feel supported, and also feel supported in advocating for themselves. As far as hair care goes, plethora of knowledge when it comes to that. Some of the stuff I experienced while I was pregnant, I know other mamas may have experienced, but they don't realize that it's a pregnancy thing. They might have just thought their hair just completely went crazy, but hopefully I can give some good tips on that.
We love that. And I'll toss it, since we're on hair, to Dr. Afiya.
Great. Greetings, everyone. I'm Dr. Afiya, a clinical psychologist and hairstylist, and I've developed something called Psychohairapy, where I use hair as an entry point into mental health services. So I train barbers and hairstylists, mental health first aid, and have collaborated with a colleague at Tulane University to do something called Talk, Touch, and Listen, which is basically training parents how the hair care process is an opportunity for emotional bonding and care.
I have
Oh, me
goosebumps.
too.
I have goosebumps.
Do
Like,
you?
yeah, no, I legit, like, my whole body, it's everything. And
Okay.
I'm like, this is amazing. Keep
Good,
going.
good. And I'm mad at Zoom right now for messing up the shape of my wash and go, because it definitely does not look like this. Okay.
Take it off. You can take it off, girl. Let's show us the skin. She like, wait, it is not flat.
I know,
on
it
this
is
side.
not. Yeah. Okay.
I was doing the same thing on the interview with Reba Martin last night. I was like, I'm gonna fluff my curls. This shit looking soft and flat on one side. It's okay.
Yeah,
You're in the safe space. Okay, so tell your Tulane story. That's when I cut you off. You partnered with your friend at Tulane. Touch and Listen.
Yeah, Dr. Marva Lewis, who developed a lot of protocols around hair combing interactions between 0 to 3-year-olds and their parents as an opportunity for strengthening attachment and emotional bonds. So I'm not a mom. But have lots of mom friends, only went to one birth, almost passed out, but otherwise I'm a great auntie. So yeah, that's where I'm entering the conversation today.
You're not a doula. Got it. Okay. You can't pass out a birth as a doula. That wouldn't work. And last but not least, Dr. Owens.
Hi, everyone. I'm Michelle Owens. I am a maternal fetal medicine or high-risk OB doctor by training. So honored to be the clinical director at May Health. Have just been elated to work with this team. I practice in the Deep South. I was born and reared in Birmingham, Alabama. Spent some time in the DMV for training, and then came back to the South to serve my community. And I have been practicing here for 18 years. And so I feel so honored to be on this screen with these people. I got like these trained hair professionals because I am a kitchen tician. I will put a chair in my kitchen and call people in. And I also am a mother. I have 9-year-old twins and a 12-year-old who is channeling his inner teenager in ways I would have only imagined. Pray for me, pray for us. But I just got so excited when I heard Dr. Afiya say what she said, because I was thinking about like this concept of like the bonding that goes into, because my daughter, that's the only experience really that I have with hair is my 9-year-old daughter, who's half of my twin pair, and her brother, who also, they have these tremendous heads of hair. And so I wouldn't necessarily call it bonding, but there's definitely something that's going on when we're getting together, trying to work through this hair thing. But I also think about how that affected me as a child growing up, with the hot comb and protecting your kitchen and all that good stuff. Like I had all of that. So really excited for this conversation and just kind of how the we're talking about, I get to talk about the medical stuff, but the other part is just like how so much of our culture as Black women and as Black people is really centered around like, you know, our crowns, our hair. So really honored to be here.
Amazing. I mean, I got a cheat sheet, but I'm like, oh, okay. I'm so excited. I'm like, where do we start? So I think what I want to do is start with Ashlee talking about like the importance of self-care outside of the hair and the nails, because my approach is inside out to fitness. So like with the pelvic floor, like I say if the vagina ain't working, nothing else can. And I really believe that. I think also if your mental health is not good, then nothing else is, you know, functioning well as well. So sometimes though, I believe we have to work from the outside in, and there's a proper way to do that and a healthier way to do that. And I feel like, thank God we're living in the time we are now with the resources that we have. So I think let's start, Ashlee, with your perspective and approach to self-care, you know, both for the mother, but also for the caretaker, the doula, the doctor, the provider, you know, the family member. We also, as caretakers, need to care for ourselves too, and often forget to do that.
Absolutely. So I think we have to start with our boundaries, right? Our boundaries that we set for ourselves, but also the boundaries that we set for other people and how they interact with us, right? So putting boundaries around our time, when and when we will not work, putting boundaries around our schedules, right? Like this is family time. That's what I do here. Or when I get up in the morning, I'm setting aside 30 minutes to just focus on me, right? I notice in myself that when I'm consistent with my routines, getting up earlier than my children, you know, 20, 30 minutes, and take a moment to just breathe and to do some yoga. And then before I go to bed, prayer, read my Bible, do some yoga, things go a lot better. I can think more clear, you know, I can deal with my children in a different way. And I think that's self-care, right? And I think it also allows us to have the capacity to do some of these other things, like get our nails done and not be guilty, get our hair done, you know, and love the way it looks and all that stuff. Like it's all connected. And so definitely starting with the boundaries, writing it into our contracts, right? As birth workers, like this is what I will not do. You cannot have total access to me 24 hours a day, or these are the things that I can do, that I won't do, and being really clear and direct about those things.
Mm-hmm. I love that. And I think, because I'm nodding, like I could be better about that. I think it helps too to have accountability partners. I feel like, you know, with your tribe of girlfriends, kind of all of you sharing these ideas and suggestions and trying to make sure that you stick to it, because it's tough. Because life be lifing. Okay. So Dr. Owens, from a medical standpoint, when we don't care for ourselves, how does that affect us, like our health? You know, the word weathering comes to mind, but can you break that down? Because I think we're so used to, as women and Black women, absolutely just continuing to push forward, not realizing the cost.
Yeah, I mean, the truth is that at some point something's got to give, right? And I think it is ironic to me that we will, as people, take better care of our cars than we take care of ourselves. If you know that if the light comes on, you're running somewhere to get it seen about immediately, right? You want to get that diagnostic test. You want them to find out what's going on. If you get on that reserve tank, y'all know what I'm talking about, the reserve tank, when the little red light comes on and you realize that you're getting low on gas, then you're looking for the next gas station. Some people even have cars that will alert you where the next fuel station is, because it's time for you to stop, because you know that you can't run endlessly on a limited amount of fuel. And yet we will push and push and push our bodies to these incredible places without the expectation that there needs to be a refueling, a regeneration, a rest, a period to stop. It raises your cortisol, which is a stress hormone that is produced by your adrenal glands, which affects your blood pressure. It affects weight gain. and where and how your weight, specifically how fat is distributed in your body. And so when we talk about weathering and the effects of that, it's like the environmental factors, environmental, social, and let's not forget emotional, but the emotional factors that weigh on us, that we might believe that we're hiding from everybody, because everybody knows how to put on the big smile. And when people ask you how you're doing, you are like 2 centimeters above the waterline, but you're like, oh girl, I'm fine, I'm great, everything's wonderful on Facebook, you're all happy and wonderful on Instagram, you're showing all these great photos, and inside you're falling apart. But it's like, we feel like for some reason that self-care or taking that break, the wellness, the space, the time just to calm down, like somehow that's selfish, and it's really not, because we do it in every other aspect of our life. Every other aspect of our lives, when the things that we need and rely upon show that they are low or damaged, we instantly get somebody to fix them, but we don't do that for ourselves. And so, yeah, it ends up manifesting as diabetes, obesity, hypertension. What does that sound like? It sounds like the top 3 health problems that are experienced in the African-American community. And so it's not really complicated, but it just takes people you have to be intentional about it.
Yeah, I'm definitely gonna toss it to Dr. Afiya, because the body is connected to the mind. But what I want people to kind of think about is, what do we think the solution is socially? Because I think the real problem is there's no structure within our own immediate families, within the workplace, for us to stop. To be fully candid, I'm fine girl in my family. And so when I show signs of not being fine, my family doesn't know what to do with that. And I don't get what I need from them, right? So that's something personally I'm combating, because I'm like, the people that I might, on paper that should be my people aren't really my people, because they need me to pour into them. But I realized at 39, I deserve to be poured into, and I really need it. So luckily I have a beautiful tribe of friends. So I'm working through, kind of realizing, okay, who I thought was my person to fuel me might not be. And kind of accepting that. So that's a personal challenge. But Dr. Afiya, can you talk about, like, because I don't know that I know the full answer to this, like when those cortisol levels like are, out of whack, the hormones, the mental health and all of that, I'm pretty sure it all is linked together. So can you kind of speak to not caring for the body and how it affects the mind?
Okay, I will do my best, but my first reaction is therapy, right? In terms of that there is a whole discipline of the medical industry to help you cope with stress, right? That is the point of therapy, and especially therapy for Black women, being culturally competent to know the complexities, whether you're the fine one or otherwise in your family, to have space of your own, whether it's 60 minutes a week or otherwise. So just to even plug therapy is a collaborative process of change. You get to identify your goals, what you want to get, how a therapist could actually support you in finding more support, right? I'm a big fan of Rest is Resistance, that book, and the NAP ministry, and just really thinking about how it is a political movement for Black women to rest and relax and take care of themselves. Again, I don't know if I'm answering the question, but my reaction was therapy.
Oh, yes. Okay, therapy done. That was a long question, a quick answer. Okay, so Octavia, can you talk about you're a mother? Did you say you're a mom?
Yes, I am.
Okay, so the word guilt has kind of creeped in a little bit here and there about mom guilt. I have a very strong opinion about mom guilt, but I would love for you to share your perspective on how you deal with mom guilt and or taking time to rest.
Okay, so first of all, that's something that you have to consistently work on. I struggle with that actually, and that's actually something I was talking to a friend of mine about earlier, because with what we do as doulas, we're constantly pouring into other people. And usually if you're a doula, that means that you have a nurturing spirit by nature. So most of the people around you look to you for that nurturing as well, not just your clients. So it becomes a constant pull at you, and you don't ever take the time to really sit with yourself and like, all right, well, who am I going to go to? And then as a mom, of course, with this job, if you're doing it full time, you start to feel guilty because you're not spending as much time with your children as you would like. That has been a thing for me, where I've been trying to find a happy medium of, hey, I have to help my clients, but I also have to be a mom. So there's like Ashlee said about setting boundaries, because that's a big thing, especially with what we do, because it's very easy to get sucked in, especially if you have a client that may need a little bit more attention. They may be high risk. So you're there more, but setting those boundaries to say, listen, sis, I got you. However, I have some stuff I have to tend to as well. I love you and I got you, but just give me a second, you know? But yeah, as far as being a mom, it definitely is tough to balance it out. And it's, again, a boundary about how many clients are you going to take, you know? Because me, when I got back into doula work, I kind of jumped in and was like, I'm going to do 5-6 births a month, not realizing how that was going to look and how I was going to feel at the end of the day. I was tired last year, honey. I did about 26 births last year. I was through. So this year, I'm really focusing on setting those boundaries and really determining how I want that to look for myself and my family. I hope that answers the question.
Oh, beautifully. I'll be quick. I use expletives, but I'll spell it. I have a capital FUC, fill in, mom guilt. I refuse. And I also would pose the question, be careful if you're feeling guilty or if you feel judged, because they're not always the same, right? Because your life as a doula might look different than a 9-to-5er. And I'm just posing this to challenge those thoughts when you feel them, is you have a lot of time that other moms don't have as a result of the path you chose. It just looks different. So, so putting my trainer crown on, I'm very passionate about movement. I also feel that movement is medicine. Truly, every time I move or I begin to teach a class, I'm like, damn, this works. Like, I feel better, you know? So I encourage women to move through their pregnancy and after, and a nugget I would give to moms is just move with your kids. You're not going to always have some perfect hour, even if it's 15 minutes and you do some squats, some push-ups and just a plank and the kid is crawling on you when you do it, and your pelvic floor exercises and your abdominal toning. Great. We're done. We got 15 minutes of movement and bonding and teaching the child the importance of movement in their life, but also the prioritization of self-care for mom. So I accidentally did that. I was very diligent about that. That was when I had my bread and butter. So I had to get my body back, both because I wanted to and because I had to be strong to make a living. And they learned, wait, mommy's going to work out. It was just what mommy did. And there was no question in my household about that. And I have 2 boys. And we often, say, oh, teach your girls about self-care, teach your girls about. But it's important, I believe, as a mother of Black men, because I'm raising men, is that they understand the importance of Black women and women in general, prioritizing their care. And my care is a priority in my life. And that's understood. Even if I break a nail, my sons are like, Mom, you need to go fix that. I'm like, job well done, mommy. So with that said, with the hair conversation, how do we manage that? Because I know that's a very common concern. Like, sis, like if I go sweat, I can't go to, we want our hair to be great and our body to be great. I would like to argue that a healthy and snatched body is far more important than a staying pressed, but let's talk about it. How do we manage both? Who wants to go first? Dr. Afiya? Yeah, you go, because then Octavia just went. So you start.
Okay. Yeah, there certainly are a lot of dilemmas between taking care of your body and taking care of your hair, but we know that it overlaps, right? In terms of growing healthy hair comes from a lot of movement, at least 5 days a week for 30 minutes. We know that healthy hair comes from drinking at least 64 ounces of water a day. We know that healthy hair comes from 4 to 5 servings of fruits and vegetables a day. We know healthy hair comes from, what you drinking? We know that healthy hair
I know. Bud Light. No, I'm kidding.
we know that healthy hair comes from stress management and trying to sleep at least 7 hours a night, a day. We could say that, maybe throw some naps in there. But yeah, just thinking about how it doesn't have to be in conflict. I actually do have a published research article called Don't Sweat Your Hair Out, where the data comes from about 200 Black women that basically were abstaining from exercise because they didn't want to mess up their hair. And so we know that there's a lot of metabolic consequences of that. Going into protective styles, right? I think that has been a key in negotiating fitness and healthy hair journey. So protective styles are basically styles that tuck away the ends of your hair, or can even open up this, depending on the style, but can have some air for the scalp when you're sweating. And so I'm thinking about when Black women tend to get these protective styles in particular, it's when they're traveling, during the perinatal period, and when they're on their exercise journey, right? Because you've been to the airport trying to fly to the Caribbean and everybody got braids. Everybody, all different types. But it kind of helps you to deal with the unpredictable nature of like the routine of, what you're about to enter into, just like for pregnancy and postpartum. But also it makes me think about at the gym too. When I see Black women at the gym, they usually have a protective style, whether it's twists, locks, braids, Bantu knots, a scarf, right? In terms of thinking about how to protect the hair during that process. But yeah, I think that protective styles can offer a sense of security to Black women during these times of hyper focus on wellness, and that it can last for a very long time period. And so that would be my first reaction to negotiating movement, hair, protection, all that.
Okay. Do we know, I have a random question. Do we know how sweat affects the hair? Like, is it a bad thing?
Well, from what I've read, that
Yeah.
you should want your head to sweat because it's unclogging the pores and follicles and stuff, and
Right.
produces more blood flow to the scalp, which can feed the hair follicle. Is that right, Doc? I don't want to be saying wrong things, but
but in sweating, so that's the way that our body helps to cool itself. And in doing that, we also excrete salt and other things. So look, it may not be the most appealing if you're talking about something that's aesthetically pleasing, but from a physiologic or from a bodily standpoint, it is a natural process, and it is something that your body is doing to preserve itself or to keep itself in a normal state and respond to the environment. So all of those things, natural things, are good. Natural things are natural.
Yes, exactly. Octavia, I had a question and it flew out of my brain. Oh, yes. You spoke about, can you quickly touch on, since we're on hair, what happens postpartum with hair and pregnancy? Because we love, most of us, pregnancy hair. And then at one point you like, sis, well, I still remember the day I was on the phone with my best friend. I was like, girl, and she Irish, Italian for both of them. But I was like, oh my God, I got black girl edges. I was like, what happened to my hair? She was like, Rachel, you are crazy. I caught a glimpse of my edges and I was like, what happened? And I knew it was going to happen, but it happens. Like one day you have a middle part, you start the middle part. So can you explain you know, how some styles and what to expect during that period so women aren't feeling shocked about that.
Okay, so from personal experience and professionally, some of the things that you can possibly, and I say possibly because it doesn't happen for everyone, but during the pregnancy period, you may develop a more oily scalp. So something that happened with me, and I had no idea that it was a thing, was like I literally had like a buildup of oil on my like the back of my hair. Like I had to use a detoxifying shampoo to actually clarify my hair because there was so much oil buildup, and it didn't matter if I was washing my hair once a week, it was just there. Once I had the baby, completely gone. So that's the thing. One of the things a lot of mamas that have come to me postpartum is the postpartum alopecia situation, where they lose like the edges. So either the texture can change, your hair texture in general can change during pregnancy. And sometimes it does not go back to what you usually have. So that's something that you can, you know, possibly expect. But postpartum alopecia can be a thing. I've had some mamas, including myself. I remember sitting in a chair with one of my coworkers one day, and she retwisted my locks and like all of this. I was like, do you think where's the it's like they were gone? But they came back. That's the thing with postpartum alopecia. It's not a permanent thing in most situations, and it can be resolved with different herbs and oils. It will help. It will come back. But definitely postpartum alopecia, extreme shedding. I've had some mamas where their hair just shed really, really bad, and they like panic. They're like, I don't know what to do. Like, what's going on? And I'm like, it's just a part of the process. You're gonna have to keep taking your prenatals, possibly add some collagen and biotin to your regimen to just help combat that. But those are like the main things. Definitely some people get like a buildup on their scalp. You can get psoriasis of the scalp. Like your body changes so much during the pregnancy process that anything is possible because your hormones are shifting, you're eating differently. And depending on how your body responds, the baby might like something, but your system may not like it, and it can 100% manifest on your scalp. So yeah.
And not to bring the mood down, but I want to share too, if anyone expects a loss, I did between my sons, and my hair responded similarly. Like, so I lost hair after my miscarriage. So if anyone has a loss and that starts to happen, just know your body experienced a birth. And so hormonally, wouldn't you say, Dr. Owens, is that what is shifting that causes the change in hair? Can you break down?
Yeah, it's really interesting. People think that like the prenatal vitamins have some miraculous hair growth formula in them. And while they do provide, you know, the basics of just general micronutrients that we need, the major changes surrounding like the thickness or the fullness or the length, the growth that you see in hair is primarily related to your hormones. And so what happens during pregnancy is that you have this increase in our female hormones. So estrogen and progesterone are the two female hormones. And they are also the two that we experience in our menstrual cycle, right? The changes in estrogen and progesterone. And what happens is you get this surge of estrogen, and that actually has an influence on a lot of other things. It influences the phase that our hair grows in. And so when you have these estrogen surges, it puts your hair in the same they tend to be in the same phase, right? So typically what happens is our hair across our bodies are all they grow in different phases. And so that's why when you comb through your hair, you don't have everything fall out at the same time. You get a little strands in your comb every now and again, or a little bit in the brush. So they shed because the older hair, the senescent hair, then comes out. But you have other hair in other phases that continue to grow, right? Well, during pregnancy, it shifts all your hair or the predominance of your hair into the same phase. So then when pregnancy ends and you get that consistent hormone cutoff, all the stuff's in the same phase. So once it all gets to that end phase, right before it's time for it to shed, then what happens next? All of the hair that was all in that last phase comes out together. And so that's why you see that happen. Which is, so it's primarily hormone mediated, but just as Octavia said, just keep doing what you're doing, because what you're bringing into your body will help you to add back. And as your hormones return to a more normal state, then that change or shift in phase will gradually happen again. But I mean, that totally happened to me. I didn't have the loss around the edges, but my hair gets really, really thick in pregnancy, and I'm a thin hair girl. And it gets really, really thick in pregnancy. And after a year of breastfeeding is when, over 6 to 8 months, it goes back to thin girl hair. But I have this beautiful, thick, full crown that I never have any other time in my life. And once that breastfeeding ends and my hormones normalize and I go back to regular cycles, I'm back to my normal hair again.
So Ashlee, since we're kind of led into like postpartum, can you just lend your wisdom and guidance about, what to expect postpartum? We haven't touched on breastfeeding, but I feel like it's a beautiful topic. Breastfeeding can be very beautiful, and can cause you to feel like touched out. So how would you kind of speak to dealing with postpartum, feeling touched out, self-care, breastfeeding, that kind of world?
Yeah, well, one, I think starting with expectations. One of the things I always tell families when I'm working with them is like, sometimes you have to throw the expectations out the window, because the reality versus the expectations can often create a disconnect, right? So if we're expecting that our baby is going to eat every 2 hours for only 20 minutes, right? Then we kind of create this picture of what that will look like. And then when we have a child that wants to nurse for 40 minutes at a time and wants to nurse for every hour, then it's like, there's something wrong with my baby, there's something wrong with me. And so I think we start with the expectations, right? Kind of throw those out the window and see what it is that your baby needs, how your baby flows, right? Because every breastfeeding situation or relationship is slightly different, right? And then I also think that we have to communicate what our needs are and what we're experiencing with the people around us, right? So if we are harboring, the guilt of like, man, I really don't want my kid on me right now, but oh, I'm their mom and I should be okay with it. And all the pictures of all the other moms, like they love holding their kids. We need to verbalize that with people, right? To tell the people that we support and love, like, hey, I'm feeling overwhelmed. I'm feeling very touched out. I need some extra support in this area, or today is just not a good day for this. And I think that will allow us to get more of the support that we need and to let go of some of that guilt, right? Because then we open the door for people to share their experiences with us and be like, oh, I remember that too. Or, yep, that is a part of it. Let me take that baby. You go and take a shower and I got it for now. So definitely verbalizing what our needs are, because breastfeeding is work. It's a lot of work. It requires a lot of your body, of your mental state, of your emotions. There's all types of stuff going on. You still having contractions in those first few weeks because of nursing. And it's a lot. And so making sure that we're telling people what's going on with us so they can support us in an effective way is really helpful.
And 2 nuggets I would like to add, because it's not, or maybe 3. The places you carry extra weight for breastfeeding is around your belly button and right here. Okay. So I want women to know that, especially once you start working out, please do not overdo crunches and forward flexion, because it can exacerbate diastasis recti. But know that fat, that extra kind of cottage cheesy feeling fat, is for the fat to make milk. So it's there for a reason, and it's going to take up to 6 months to fade away post termination of breastfeeding. So once you terminate breastfeeding, give yourself 6 months, and then those places where you're like, damn it, I can't get these off, they're not supposed to go away because they're making milk. The other thing is, I read a study recently. It said you use 30% of your energy to create milk. It's more than what your heart uses. And you need 500 extra calories a day. So no fasting, all this stuff. No.
Can I add something to that?
Yes, absolutely.
So you know how folks usually say, like, when you're pregnant, you're eating for two?
You're
In
not.
reality, when we're talking about calories, right, it's more like 1.5. When you're breastfeeding is when you're eating for two. And a lot of people don't see that, especially support people like partners and grandma, and they're like, you eat like a cow, or you eat. There's a reason, because
Right.
my body is doing work. So
Yeah,
Yeah,
and that's not
pregnancy,
time to
300
worry about-
kilocalories. Pregnancy, 300 kilocalories a day during pregnancy is your extra need expenditure. 300, that's like a Snicker bar, like one. Period. It is half of a Krispy Kreme donut. That's it. It's like one.
I love that you're telling your location with the examples. Snickers is my favorite though. Okay. If you could speak, Dr. Afiya is over there like, I have not breast. Okay, do I want to do this? I don't know. Did I read that right? You were like, what? I gotta do what? The other things for being touched out, carriers, baby wear, so your hands free. That really helps. Just use the carriers, register for one. Connection between community, mental health, and hair. Can you, what you jumped off, like started this call with, was just so magical. And it can you please share your work and give us a little bit more color about that? Because I do feel like hairstylists are like our therapists. So it just makes a lot of sense that they have good tools to help us with while we sit there for hours.
Yeah. So I developed something called psychohairapy when I was in college. I always loved doing hair. I was like my friend's hairstylist, my family's hairstylist. And so when I was in college, I remember talking to my aunt on the phone one day and telling her I didn't know if I wanted to go on to study hair or psychology. And so she said to me, well, why can't you do both? Now, I don't think she was telling me to do both at the same exact time, but that's the way I interpreted it and thought, I can do hair and therapy together. And so I then went on to get my PhD in clinical psychology from Howard University, because I felt like I really wanted to understand Black mental health in particular. And then it wasn't until after I had a private practice and was like a tenure track professor that I then went to hair school. And so really like studying the hair salon environment and the conversations that we're having in that space are very health oriented, right? Eat this food, or don't wear this style because that will pull your edges out, or, these sort of conversations about dating and mothering and things like that. A lot of pregnant women in that space. And so based on some of the conversations that I started to collect data, actually had a research study called Hair, Health, and Heritage, where I collected data from hundreds and hundreds of Black people by going to hair salons and barbershops to collect information about their health behaviors, if they were drinking water, exercising, all of that, information about their racial identity, information about their hair experiences, and develop then a curriculum. So I, am uniquely qualified to create this hair and mental health curriculum that is 12 hours long, where we go through the history of our hair, because I think it's really important for everyone to understand history. It gives us a location, a time to see where we fit within this sort of historical spiral cycle, and understanding that that time is not linear, but cyclical, right? I go really in depth, like thousands of years of hair history. Then I go into understanding signs and symptoms of mental illness in communities of color, right? Because we recognize that the way that depression might show up for Black women could look a bit different from other groups, right? A lot of the psychological disorders are based on white, wealthy, heterosexual Christian men. And none of us on this Zoom probably identify with that. And so there's a bias that exists in terms of diagnosis, but to understand like things like anger and how it shows up in anxiety and depression for Black women. And then
you give those? I just want to put a pin on that. Someone created like a Instagram post or something, but it was so right on. Can you explain how our anxiety, depression manifests, like, or shows and maybe as a viewer of that, like how to do that. I mean, the other day at my son's school, she was presenting a way that you're going to probably explain. And I got a little bit of an opening, and I just gave her a hug, and she started bawling. And I think more of us need a hug, but we present so strong because we don't know where to get that hug from or even to ask for it. But I think that's really important, even just for our individual self, to know like, oh, maybe it's this that I'm dealing with.
Yes, I think it's important to understand how emotions in particular can give us messages about our needs, right? So I can go down through a few emotions just to even identify what the message is and what the need is as a result. So let's get into sadness, right? That's something that people experience all the time. And so sadness is an indication that you're experiencing a loss, not just like a death, but a loss of an opportunity, a loss of a relationship, a loss of a connection, a loss of money, a loss of sleep. And so that loss can indicate that you need comfort, right? You need comfort. This is an indication when I'm sad, I need to be comforted. Now, comfort can look different for different people, but that it's communicating that need isn't being met. Let's look at fear, right? Anxiety, fear. That is indicating that you don't feel safe. You don't feel emotionally safe. You don't feel physically safe. And so what you need in that moment is a safety plan, right? So that's a need that you have. I need to have structure to feel safer, whether again, it's coming up with a financial plan or literally when you travel, to put a doorstop at a hotel when you're traveling. Like, how do you actually deal with that safety piece? We can get into the anger piece, right? Because I think people really misunderstand Black women's anger. Anger oftentimes is an indication that there has been a violation or a missed expectation or a boundary that was crossed, right? And so it really can hurt, right? Anger is oftentimes a reaction to feeling hurt. And so what you need when you're experiencing anger at such a deep level or even a light level is a need for new boundaries. I love Nidra, I think Glover Tawwab's book, I think that's her name combination, Set Boundaries, Find Peace. I don't know if you all have read it. I highly recommend that book. So it's written by a Black female therapist. Set boundaries, find peace. Set boundaries, find peace. That book's so good, it made Ashlee disappear. So set boundaries, find peace. In terms
but wait, you had naps. You said 3. Set boundaries, find peace. I almost said disappear. Maybe that's part of your boundary. Disappear, set boundaries, and disappear. That's a new one. And then nap.
Rest is resistance, and that comes from the founder of Nap Ministry. Rest is resistance. So that was actually our January book club for psychohairapy. Rest is resistance.
Okay.
So that focuses on why and how Black women take naps and get rest. But getting into the need for boundaries. And so as we know, Black women's boundaries are being violated all of the time. And so that can result in a lot of frustration and anger in particular. Or even trying to think, we talk sad, or even shame. Shame is an indication that we need to talk more. Like, that just is an indication that this topic needs more attention and focus more than the other things that you're probably bringing up. So, yeah.
Okay.
So stylists, community members, they get the training and all of that. It's emotional intelligence, right? I don't know about you all. I never learned anything about mental health in school. I think health class, we talked about eat vegetables and don't get pregnant, right? That's what we learned. I know I went to New York public schools and that's what they taught me, but I never learned what to do when somebody's having a panic attack, or what do you say when someone is experiencing grief, right? That somebody died in their family. And so to really come up with ways to have conversations and support people emotionally through everyday struggles and really traumatic experiences too, right? To be a trauma-informed doula, to be a trauma-informed hairstylist, to be a trauma-informed parent, right? To understand the necessity of how to show up and care for folks in different emotional states. So that's what I do.
So many jewels and gems. I think the biggest thing, and I know we're running out of time and I'm going to finish with Octavia, then I want to go round robin, how we all follow you and support all that you do. The last question will be, what's your ask because I want us as women to be vulnerable enough to ask for what we need. But the shame and the not talking. I have a real problem with how we have to hide our pregnancy, hide our pregnancy loss, hide our infertility, hide our relationships issues. It's just so much hiding and shame. And I feel like until we start to share, can we then learn and therefore heal and thrive? So thank you for that. And I encourage everyone to share. And if you don't know how, come talk to me. I'm really good at sharing. I just let it go. My family's like, more editing. I'm like, no, more be free. Octavia, supporting those who support us. How do we do that? I know that was a really easy question. So you talked about earlier how, doulas are nurturing by nature. But we also have to set boundaries. But one thing that comes to mind is do you have an accountability partner as a doula to help you nurture yourself? But I think just for the lay people in the community, how can we be mindful of caring for those doulas, doctors, mothers in our community?
I think one of the most important things that a community can do for all of us is to recognize that although we appear as super women, we are not. We are human, and we have to have that time and that support from the people around us, understanding that yes, we're there for you, but we also need time for ourselves. With what I do, with a lot of the clients that I have, the demographic that I work with, I see it a lot where they don't have support. And it kind of falls on our shoulders to provide all of that support to them. So it's like maybe when the community recognizes that there's such a huge demographic of individuals that really do need that support, it's more than just saying, I got you, it's actually showing up. And that's been the toughest thing with the demographic I work with. People will say, if you need anything, girl, I got you. But then when you actually need it, they're not there. So for us, it's a big thing of, like you said, having an accountability partner. And I think that also stems from that I can do it on my own, independent kind of connotation that comes with us of I got it, I don't really need anybody, but that comes from a history of being let down in the past. So you get used to doing everything on your own. So I think the best thing a community can do for us, doctor, doula, midwife, whatever it is that we're doing to serve the community, is to actually show up for us and recognize that, like I said, we're not superheroes. We get tired sometimes too.
Yeah, I love that. I think too, being forceful with those friends that kind of fade into the background, you can kind of have that sixth sense when somebody's not good. And I feel like I'll share this because it was helpful. Like a girlfriend of mine in high school, we went to see some boys, and then there was a situation that was not kosher with her dude, and we drove back, and I remember I knew it wasn't okay, but I didn't check on her after. I have been out of high school for a very long time, but I remember the devastation and the pain in her face. I'm start crying now. Woo, when she's like, you never checked on me. And I didn't want to bring it up because I felt like that would trigger her. But from that point forward, I will always trigger you because at least I'm thinking about you. And it's like, if I could give that to someone, I will never forget that moment. I let her down so bad and it still hurts me. I feel like I have to text her today. So just check on us, because the strongest of us, the happiest of, we are. Yes, it's I think for me, I can say I choose joy. It doesn't mean I don't have pain, right? It's a choice. So I feel like this panel, Rachel sitting right here, is the shit. We could talk for 18 million hours. I just want to meet everybody and just have a sleepover. Everybody can go over my house. Okay, So because we have like 5 minutes, tell us your name again, where we can follow you, and what do you need? I don't like, make it a big ask, not a little one. Like, what is your ask? Ashlee, go. You're back just in time. Or do you need a second?
No, I'm fine. So my website, Birth Class in a Box. I'm on Instagram. I'm on Facebook too, but Instagram is my preferred space unless it's a Facebook group. But also Birth Class in a Box. What do I need? I need birth workers who want to partner together and be vulnerable with each other, and to create systems and to do things for our community as a team. And to do some like retreats together, and to just step outside of themselves to do something as a community. So
I love it. Octavia.
Hey, so, well, I have my Instagram page, which is Touch of Zen Tay. So Touch of Zen and then Tay, T-A-I. That is my main Instagram. My Facebook is Octavia Zen Smith. My website is Touch of Zen by Tay. Like I said, I do energy body work, and I do, like, my big ask is to be open to new things, especially when it comes to energy work and things like that. Like, I'm definitely looking to help other birth workers when it comes to that, because we pour into people so much, not just birth workers, doctors, nurses, midwives, whatever your role is, especially if you're working in healthcare. I want to try to start giving back to everyone and offer discounted bodywork services, because you don't realize how much energy you're pulling from these patients and clients and how you hold on to it. So my big ask is to start supporting yourself more when it comes to that aspect, and learning how to release those energies. And I'm here. You can inbox me, send an email, whatever you got to do. My big ask is to be open to coming to me or any other energy body worker, or just so that you can get that extra support that you don't even realize you need until you get the service. Okay.
Totally. Dr. Owens.
Yeah, so you can follow me on, my Instagram is underwhelming, but I'm working on that. Instagram at Dr. Michelle Owens. I'm being honest. I'm on Twitter at Dr. Michelle Owens. Now, Twitter is kind of my jam, but I'm working on the gram. So, and look, if you find me on Facebook, you will only get these ridiculous anecdotes about like the hilariousness that is my family life and my crazy children, whether it's, Twinanigans or the Trip Chronicles, where I kind of just write out some of the stuff that happens. But my ask would be, number one, for any and every Black birthing person to recognize your worth and to not let fear steal your joy. Don't give up on us in medicine, because there are plenty of us out here who see you and who care about you, and who want to care for you, and who want to see you not only survive, but who want to see you thrive. So don't be afraid to speak up and speak out. You are the expert on your body, and don't let anybody else tell you otherwise. And if we do that, I think that there'll be fewer people that we will lose, and a lot less sadness in the world, and a lot more joy around what is one of the most amazing experiences in a birthing person's life.
Amazing. Dr. Afiya?
Yeah, I would echo that, and investing in your own health and wellness, to recognize your own emotional, physical, and psychological needs, and to get certified in psychotherapy. So I just put the link in the chat so anybody can get certified. If you love hair and want to improve mental health for yourself and other people around you, you can sign up for a course. Our next one is April 22nd and 23rd, and there's a May 16th and 17th. Anyway, and you can follow me on Instagram. My Instagram is Dr. Afiya, Dr_Afiya, and also Psychohairapy. So I would love for you to stay tuned with all of the wellness content that I'll be sharing around basically that parallel between self-care and hair care.
this is an honor. I'm gonna ask for something different, but you can follow me at birthqueen.org and at Rachel E. Nix. And my ask is abundance. I want to fully fund Birth Queen because my vision for Birth Queen is to be the castle that houses all the support and change and all the work that we're all doing. And then my give to each of you is I would love to highlight all of you on my platforms personally and on Birth Queen and on my Black birth worker calls so that queens can continue to absorb all of this delightfulness. And Dr. Owens, I'm gonna put your last quote on my Instagram because I always say my mom raised me and said, you know what's best for your body and your baby. And so I just want to know that my mama said it, I say it, but a doctor said it. So I'm gonna keep saying it. I'm like, no, Dr. Owens said the same thing.
Girl, say it loud. Say it loud. Because people need reminding. These folks need reminding in these streets. They need reminding. So yes.
Yes. And she got letters behind her name and she said in these streets, just saying. I have to go run on upstairs and put on another crown because I am still working. This fueled me beyond words. I am very emotional in all the good ways. I love you, queens. Keep doing what you're doing. You have inspired me. To everyone that joined, thank you. And I'm gonna pass the mic.
Thank you. Love you. Thank you. Thank you all for joining us so much. Y'all are amazing. I so appreciate you so much. We are going to share on our IG at May Health Inc. all of your profiles, all of your IGs and websites and every way to find you. Also, if anyone is looking for a replay of this conversation or to share it with anyone or to see some of our previous conversations that matter, please visit our YouTube. We are at May on YouTube. And again, you can find more resources, education at meetmay.com. We actually have a class with Dr. Michelle Owens on Monday evening at 7 p.m. It is postpartum priorities. You can sign up at meetmay.com/classes. It is free. Profiles are free. And these classes are an incredible opportunity to get some one-on-one time with Dr. Owens. So if you are interested, please join, share. Thank you all, incredible, beautiful women, for this conversation. It was something that was not only really important to us and a team and me, but I also had chills and was emotional, sitting next to Rachel watching all of this. So thank you. Any final words, or are you guys good to go? Thank you so much. Thank you all for joining us, and please tune in for future conversations. Thank you. Happy Black Maternal Health Week.